My name is Jacoby Briotes and this is my practical 34 hemorrhage first aid.
The equipment I will need for this initial patient assessment and first aid include my PPE, which is some gloves, some eye protection, a thermometer, lube, stethoscope, timer, vet wrap, and some swabs.
When going to catch Jim Bob, I'll make sure there's no hazards and make sure there's no doors open or dogs running around the clinic. Just check around. Yep, all good. When approaching Jim Bob, I'll make sure I'll enter calmly and slowly because he may be frightened as he's injured and may be painful, so he might react to me coming in. I'll approach him with the slip lead to put that on him, nice and calmly, and then securing that tight so I've got hold of him. This is Jim Bob. He's a male 3-year-old brown Staffordshire Terrier. He's 32 kilos. I've taken Jim Bob off the owner now and they were applying just hand pressure. So I'll take over from that and then I'll grab my swabs and hold pressure there and I'm applying the vet wrap. And ensuring it's on there nice and firm so it stops bleeding and forms clots. Okay. And I've noticed that the bandage is starting to get soaked with blood, so it's striking through. I'm going to apply another layer of bandage. If I move the initial bandage, it can dislodge spots and make it continue to bleed. So I'll put another bandage over the top and wrap that even firm as well. And once we know that the bleeding has completely stopped, we can bandage it properly and have a better look at it. When reassuring the clients about the status of Jim Bob, I ensure that I use a soft tone when speaking to them and reassuring words to get across that we are stabilising Jim Bob, but he's not out of the woods yet, and that we're just managing his blood loss. It's important to record and check vitals as soon as they get in, so we have a baseline of vitals to work from, and if those vitals change, we can go back to this and have a look and see how drastic the changes are, and just to see where they're at, whether they're in shock or to go from there. When lifting Jim Bob, the client should, because he's so heavy, the client should have 2 people and a stretcher or a makeshift stretcher, whether that's a towel or a blanket, and putting him on the blanket, and then one person at each end carrying him without letting him move as much as possible or disturbing the wound.